school superintendent, and I'm joined by colleagues from also the City of Milwaukee and Health Commissioner Mike Tortoritis and his team. Today marks a really important step for our work to free our schools from the lead dangers that we have all been experiencing. Today we enter the next phase of this work, guided by the Lead Action Plan we are releasing today. Here it is. This plan is comprehensive and was created by our team here at MPS and was advised on and approved by the Health Department's team. It will guide our approach moving forward in a way that is predictable, transparent, and creates the urgency that we need. Here's what I know today. More than 100 of our school buildings were built before 1978, which is when lead paint was banned in this country. We assume all of those schools have lead in them. But that does not necessarily mean there's danger. Lead is in lots of places, including some of our homes. It becomes a danger when it is disturbed. As we work to free our schools of potential dangers, the Lead Action Plan will provide our roadmap moving forward. The main strategies of our plan include an immediate visual inspection and environmental sampling in every building that was built before 1978, serving our elementary students. Enhanced environmental controls in high-risk areas, temporary school or room relocations when necessary, clearer, more frequent communication with families and staff, expanded access to blood lead testing and support services. We are making good progress in our work to make our schools safe from potential lead dangers. And as you know, on Friday, Fernwood Montessori School reopened to students and staff. That is our 5th school that has now successfully been cleared of lead dangers. We are making steady progress at Starms Elementary and La Follette and hope to complete work in those buildings in the next coming weeks. Moving Fernwood back to their building from the Douglas Middle School building, where they had temporarily relocated, which they call their sister school now, provides us with the opportunity to move on to the next schools on our list. Today we are informing 2 other school communities that they will also relocate to available swing spaces at Douglas Middle School for the remainder of this school year so that work can begin in their buildings. Those schools are Brown Street Academy and West Side Academy. Those moves will happen on Monday, May 5th, for West Side Academy, and May 12th for Brown Street. I know moving a school is incredibly disruptive to our students, to our families, and to our staff. And I can't express my sincere gratitude enough to everyone for their patience, their understanding, and partnership. While there is no immediate danger in these buildings, and no students in them have yet been identified as having elevated lead levels, there is significant work that needs to be done in many parts of the building. It will take time and it will take people power. Starting in May, rather than waiting until the end of the school year, gives our team the ability to complete this work well in advance of the next school year and also allows us to work on other buildings over the summer. There are other buildings we will work on this year that will not require full relocations. The work in those buildings is isolated and can be done by restricting access to certain parts of the building or the campus. We are in the process of determining the order of that work currently and will share that information once it is finalized. Our team expects we will be able to complete lead cleanup in all buildings built before 1950, and there are 54 of those, before the start of next school year. Much of that work will happen over the summer. Furthermore, we expect cleanup to be complete in schools. In the schools, there's 52 of those, which were built between 1950 and 1978 by the end of this calendar year. All schools built before 1978 do not have lead paint in them. All schools built after 1978 do not have lead paint in them. I just want to be clear, I was clear on that. To date, this work has cost the district close to $2 million. And I don't yet have a final figure to share on how much this work will cost to complete all our buildings. But as we build our budget for the next school year, we will have more to share on that. I know many have asked if the cost of lead cleanup will be paid by individual schools. And I can confirm, as I have before, that all costs will be paid by the district and not individual schools. Working with the health department, we are asking families to remain vigilant and to please have their children tested for lead exposure, either by their family health care physician or through one of the pop-up clinics that the city has put on. You can find information on the city website. You can also find information on the MPS website. And also there are questions and answers, frequently answers to questions on our MPS website as well, FAQs. We know what needs to be done, and I'm confident in this team to get it done. I'm pleased we have reached this important milestone in our work and that we are one step closer to having this issue resolved for our students, our families, and our staff. Having safe, clean, and welcoming environments is critical for our students and a value of MPS, and we're working hard to get that done. I'm now glad to welcome Dr. Tortoritis to the podium to offer some remarks, and then we can take your questions. Thank you.
Good morning, everyone. I'm Mike Totoritis, the City of Milwaukee Health Commissioner. Just wanted to provide some updates about where we are, and I think then the plan is that we're going to take some questions afterwards. Okay. So we're really pleased with the progress that has happened so far. Dr. Caselius has hit the ground running and bringing in the right support to do the work at the schools. This continues to be a really challenging time for our city and for the parents here in Milwaukee, and really grateful to everyone that's contributed to this. So Children's Wisconsin 16th Street Community Health Centers have all volunteered their time and staff to help do the screening clinics. May 7th is the next large clinic, so if you haven't been able to get into your provider to have your students tested, please make a plan to come to May 7th's screening clinic at North Division High School. Further information about the clinic is on our website. We've been watching the screening data for the entire city to see if there's been any upticks. We have not seen any additional cases identified through the blood lead screening. We are investigating a couple more referrals that we've received at other schools and are working collaboratively with MPS on those additional cases. As everyone understands, when we do receive a referral or a complaint, we have to discern whether it's a poisoning from their home or a secondary address affiliated with that family, or if it's tied to the school. So those investigations can take a lot of time, but we're committed to continuing to do this important work during this period. Again, thank you to Dr. Caselius and her team. They've done a lot of work to get here, and I understand parents were quite frustrated with the duration that Fernwood took to renovate and to make safe again, but these are really important investments and stabilization activities to ensure that the children do not have long-term permanent brain damage. So these are short-term inconveniences for a long-term stability plan, and the lead action plan that's released later today really outlines how do we get back to compliance with the lead standards that are in place today. So with that, I'm happy to step aside, and then I think we'll take some questions.
Dr. Caselius, you mentioned that all the costs will be paid by the district. Do you have a rough estimate of how much that will be?
We don't yet have a rough estimate. We've paid about $2 million so far in invoices, and expect further invoices to come as we continue to add schools.
I'm sorry, I just want to make sure I have these details right. 54 schools that are pre-1950 will be cleaned by the start of the school year. An additional 52 schools by the end of the calendar year. When were those 52 schools built?
Those 52 schools were built between 1950 and 1978.
Can you kind of take us inside of Brown Street and also West Side Academy? What's the issue with those schools right now? Is it like dust by the ceilings or the window sills? Can you kind of paint a picture of what they're going to be cleaning up?
Yeah, I can give that to our expert here. I don't know, Mikhail, you want to share that? Mikhail Manin, who has come on loan from the city, has been helping to lead our lead efforts here, and he is an expert in lead remediation.
Yeah, good morning. So question is, what's the inside condition and what caused it? A lot of these buildings, and we've prioritized the oldest ones first, and so if you can think about it, if it's the oldest building, it has a lot of lead paint on it, just because it's older. And then just the surfaces of where they're at and weatherization that happens from sunlight, humidity, in a lot of these older schools. So a lot of these schools have a lot of painted surfaces. That's just as easy as to put it. Wood cabinets, built-ins, walls, ceilings, floors, ducting, piping. So we do have to go through them all. It does take a long time to just renovate it, just because of the square footage, and it takes a lot of time just to clean it as well. Yes.
When will we be able to access those reports?
Well, soon, yeah. I think they just have to be put together. I don't have an exact timeline, but I would say within a week or so.
Yeah. That's a really good question. So there are two routes for potential exposure. There are acute routes. So if a child ingests paint chips, that's extremely concerning to us, and that's one of those criteria that we use when we're deciding whether or not a school needs to be closed. If there's a lot of paint chipping that's accessible to the students, that's a major concern for us. And then there's chronic exposure. So that's potential small ingestion of small paint chips or lead dust exposure. So whether through inhalation or through potentially running a hand through some lead dust on a windowsill and then licking your fingers or something like that. So those are two potential routes that we are concerned with. With the acute route, generally we're going to see those cases present within 2 to 4 weeks of an acute exposure. So that's why these screening clinics are really important. So if you're concerned about the safety of your child, make a plan right now to get screened. And some parents are wondering, should I get them screened every month or every week? Or I think if you have them right now, that's a good indication of where they are right today. The district is taking a lot of protocols and precautions right now across the district to increase cleaning and to make safe the schools. The chronic exposure is a more complicated question because that could also been a chronic exposure at a home. It could be at a secondary address. And if folks around the town hall, they heard Dr. Parody from Children's Hospital talk about some children have lead absorbed into the bones and it can release slowly over time. So the chronic exposure is a concern of ours, but rest assured for parents that are listening and are concerned about the safety of their children, when there's the chronic exposure, routine lead screening is something that will catch that. So it might not present this year, but it might show up next year. And if you have a child who has an elevated blood lead level, those are always referred to our health department, and we will always investigate. So you will never be alone in investigating what's going on with your child. So it might be kind of scary, but we have a really good track record of seeing those levels come down if they do test high. And we're looking into potentially revising our testing recommendations for the city. So our recommendations are essentially annually up until the age of 6, but now we're kind of weighing what's going on right now in the city as to whether or not we need to revise potential testing recommendations beyond the age of 6. Yeah, unfortunately, as we spoke to in earlier press conferences going back into January, the level of degradation is something that didn't happen overnight. It could have been years of paint degradation. As Dr. Caselius mentioned, lead can be present as long as it's not disturbed. So with the level of paint degradation and lead dust that we've detected in the schools, that's highly concerning, and again, why we're taking these steps to remediate and to close some of the schools. But I think the long term, if there were children that were chronically exposed over a period of time, that's what we're still doing. And that is what our program for childhood lead prevention is really geared at, is long-term surveillance to make sure that children that may have been chronically exposed have a touch point back with the health department.
Could you speak a little bit to, you said there are additional investigations of kids who have done lead poisoning, right, whether or not they were poisoned at school. Could you speak a little bit more to, why you're looking at those schools and whether either or any of the schools that you're looking at are either Brown Street or West End Academy?
Yeah, so I forget which exact schools we've gotten referrals from parents that were concerned. So we're following up on those investigations with the parents. Again, whenever we have a referral, whether that's through the state surveillance or through a parent reaching out, we have to discern whether that person was potentially exposed at their home, a secondary address like a grandparent or a friend's house, and then in this case, we would be looking at the schools. We continue to do that, and at this point, I think we have 3 additional complaints that we're looking into.
So it's like a total of 7 children whose cases you looked into related to that.
Yeah, there was a couple more, but they weren't related to the school. But so the 4 that were confirmed to the schools, and then all these 3 additional that we're looking at. Yeah, so 7.
The relocations are happening next week. Why should parents feel safe to continue to send their kids to school?
So as we've talked about in prior press conferences, there's a visual inspection process that we've been using with the district, and now with Director Mannon, who's now on loan to the district, is working with a third-party vendor to kind of take what we've been doing and enhance it across the rest of the schools for the district. So the district has made really wise investments in bringing in contractors to help do the visual inspections. And based on those visual inspections, we've made a prioritization list of which schools should be closed, which schools can be partial closures. So we feel confident in this process right now that the district is prioritizing the right schools for closure, and then essentially helping us make a plan for the schools to be safe that have to be partially closed, and then getting us to the summer where obviously the students aren't in the schools and they can do substantial renovations.
What role will parents and families have monitoring or providing feedback on the cleanup efforts moving forward?
Do you want to take a stab at that?
Please ask me again.
What will parents and families have what role will parents and families have monitoring and providing feedback on the efforts moving forward, cleanup efforts moving forward?
Well, parents, we have town hall meetings. They can let their principals know and their teachers know. Obviously, if they go to their doctor and get a result that shows a higher lead rating, then they would want to notify us and our nurses, and we would notify and work with the health department on that. And so that's the kind of way that they can be involved.
I wonder if you could speak a little bit to, I know that you're newer to Milwaukee, but I wondered if you could speak a little to the lead action plan and why it kind of had to get to a crisis stage to make the changes that you're announcing today.
Well, again, like I shared at the last press conference, I can't speak to what happened before. I can only speak to moving forward. But I know that putting in place a strong leadership team was part of our assurances of being able to get to this place of writing a strong plan. That was a strong partnership with the city to make sure that we had all of the capacities built in there that we need. I think moving forward, you're going to see additional budget investments in our facilities team so that we have not only the bodies but the proper training for our staff to be able to move forward confidently in remediating this lead issue within our schools.
Can you or school board chairs on board speak to the districts looking into potentially suing the food companies for that same?
That might be a question for either one of you. Okay. We can't comment on that at this point.
Why is that?
You mentioned prioritizing schools based on age and conditions. Can you provide any insight into which schools might be next in line for lead stabilization and cleanup under the new plan?
We will be announcing some schools on partial closures coming up next, and then as we continue to do our visual inspections, you can expect that we will continue to update the public and particularly the schools that are impacted on when their school will be on the list. Many of those schools will be during the summertime, so we will be trying to do that work when there aren't children in the buildings.
And what is the communication between families? Is it different with certain schools? Is it all the same? Are they just getting an email? What's the communication?
Well, they get a communication home to them. It goes up on our website. All of the families will know when there's a school that's going to be closed. We're trying to give enough lead time for the families to be able to know that this is coming. So we have just the remainder of the year. The next set of schools will be partially closures. And so, or partially relocations, not closing. So they'll be relocated into a different part. For instance, I think Lloyd School has, maybe 4 different buildings or something like that. That could potentially be on the list of a school that we would look at, because you could just move kids into a different type of building and then work on another building. So there's different schools with different sets of floor plans that we would then look at.
When did you guys know that these 2 schools would face relocation in the decision making?
Well, we've been looking at the schools and assessing and prioritizing with the health department on which ones we could do and which ones we could move quickly, and try to do so with urgency. We're hoping they will be open this school year, yes.
Has there been any change to federal assistance, and if there haven't been any changes, can you speak to that?
Sure. As we've been speaking to, unfortunately, the elimination of the staff in the National Center for Environmental Health and the CDC, that came as a big shock to us. And as folks might have seen with the denial that we received back from the CDC, they cited the elimination of that team as reason that they haven't been able to support us further. As far as I know, we haven't had any other reach out from the CDC in terms of offering any technical expertise to us. From my understanding, the childhood-led team at the CDC really were the experts for the nation. So that's been challenging for us. We are working closely with our state partners and our colleagues in the Big Cities Health Coalition to troubleshoot what we're doing. And thankfully, the CDC staff, when they were still in place earlier this year, really helped us to validate a lot of the screening stuff that we were doing and protocols that we had developed. So I feel confident where we are right now. It would be really nice to be able to pick up the phone and call them. Unfortunately, they're gone. We are looking at potentially bringing in some CDC staff after, from what I understand, they're still on administrative leave right now. So once that expires in June, there's some discussion that we might actually bring them on temporarily to help in this moment. But again, we have to wait for the administrative leave to expire with the CDC to be able to contract out with those experts. Yeah.
Can you see the federal funding cuts to the lab work that MPP is doing that affected your MPS or the other lab work?
So the rescission of funds that we've had happen so far have only been for COVID recovery. So that's the $5 million that we lost a couple weeks ago. We're concerned about all of our federal funding, I think, as every health department is across the country. There is very little forewarning, and as was leaked in the Washington Post a week ago or so, the HHS potential reorg is quite concerning because there's further elimination of teams and expertise in the federal level, and tying that back to what corresponding funding cuts would happen is something that we're watching really closely, I think, with the rest of our national partners.
I was